Hello,
Like I
hello,
said,
hello,
I can
doctor.
tell you all seem very happy to have your
Morning,
mics
doctor.
and be able to talk again and stuff.
Sure
Let me go
thing.
ahead and put this on record. Okay, start recording. Come on, baby. Yeah, that's what I want you to do. I'm just waiting for it to tell me it started. Well, it didn't. Come on, sweetheart. Work
It
for
did
me.
now.
Okay, stop. Why won't it start recording?
Doctor?
Doctor, the recording has started. It's already shown in Firefox.
It's showing for you. Ah, there, it finally popped up on my screen. Yay! Why does everything come faster to you all than it does to me? It must be my location or my internet or something. Sorry, fizzy water for breakfast. While we talk, I have to have water. So, what I wanted to do is you all are group 2, and this gives us a really nice chance to have discussions again. So I'm really happy about that. Today, we're going to talk about a couple of different things. The first thing we're going to talk about is going to be the population pyramids. If you remember, I assigned you homework over the weekend to watch a 5-minute video on population pyramids. Does anybody want to tell me kind of what was the big thing? What is a population pyramid used for? Boy, you all were talking a lot in Arabic before, but now you're not talking at all. Come on. What does it tell us?
Doctor, isn't it like the population pyramid is type of graph that is used for the mortality rate for both genders, the male and different age groups?
It is showing us that. Is it showing us more than mortality, though? Is it also showing us...
It shows the cure. It shows like the number between. It doesn't rely only on like the gender. It also could rely on population. It also could rely on countries, cities, etc. It's not only about the mortality rate. It could be also the cures. It could also be how many people have the morbidity of a certain disease. How many people are...
What's the bottom of what's at the bottom of the pyramid? What's the
gender, the hours of the gender?
Age group, births. Remember 0 through 4, so it's also showing us, besides deaths, as we get towards the top or throughout, it's also showing us the birth rate, isn't it?
Right.
You're like, oh gosh, yes. I didn't know the question was that easy. Abdullah, I see a hand. Yes. Abdullah, you have a hand? And guys, I don't have you all on mute, but please, if you're not speaking right now, could you please make sure your mics are off? Because I'm hearing a lot of background noise. Okay, I'm hearing lots of background noise. Okay. Now, exactly. So you were asked to watch this video on population pyramids. So today, I'm not going to spend a lot of time explaining how they're set up, but I do want to take you through, and we're going to specifically spend some time looking at Jordan's and the transition that has happened. You all were correct when we talk about it's two different things. This is just a little one down here, and it's just showing the differences of, we can do by age, and so it starts with so it gives us an idea it's done in 5-year increments, and we move up through age, and we have gender on each side so we can see the number of males and females. So we definitely start to get to see, is there changes in the population? Is it normal changes? Is it abnormal changes? Things along those lines. I know they talked about in the video, they showed some differences of when populations age, and we're going to look at that. It specifically talked about Russia, I think Rwanda or Uganda, somewhere in Africa, and it talked about Canada as the 3 different examples to show very differently how a population pyramid works. How do you read it? Well, like I said, the video shows that really clearly. Guys, I'm still hearing lots of background noise.
حمادة سكر
حمادة.
Thank you. Okay,
He's
because I don't want to
sleeping. He is
mute everybody. I do want to let you talk. But that means that people need to have their mics off if they're not talking. Okay, Ali, I see a hand raised and stuff. I'll come back to you.
I think he's sleeping now. Oh.
لين
I
سكر الماي.
mute everybody.
لين سكر الماي.
Okay.
Hey.
سوري لا ريلاكس
يا شاب سكر المايك يا حاج. لو
يا جماعة والله لو شاف المايك كان سكر يعني ما في داعي تقعد تحكوا خلاص.
دكتور
There are enough of you on. What happened?
Doctor, please mute all.
I'm trying. It's not.
صباح الخير.
counting.
يا اخوان عمرنا 18 سنة كلنا معقول ما حداش عارف يستخدم الهاي ويطفي المايك.
I've tried her. I've got her as a mute participant. It's
لين سكر المايك.
What is this?
حمادة سكر خلاص ظلين
لين سكرت خلاص سكروا كلكم.
okay, guys. Can you all? This is why. I need just everybody to bear with me, okay? I appreciate you all telling me. I know there's a mute all button. It's not working on my side. I can see who's talking because their speakers highlight, but it's very slow in responding because there's so many participants. When we get to this bandwidth, I know for you all it shows things much faster. Like I said, for me, I see a very long delay, and I can't always make it do while I'm pressing a button that says mute all. It doesn't necessarily mute everybody. So you have to bear with me, and I'm really asking, I'm going to ask from here on, please make sure kind of when you join that you have your microphone muted unless you're asking a question to class. Okay? That will make it very easy for everybody. Right now we have about 225 of you on here. And like I said, I do not know why the bandwidth slows things down from this side, but it really does. Okay? So, that being said, let me come back to the first thing we're going to do today is we're going to talk about how we read it. Like I said, the video kind of showed you this in a very easy, lovely way. But when we look at the base of a pyramid, we're looking at birth rates, okay? And we're going to come in and we're going to see, does anybody remember, are there more males or more females born from our last class?
Males.
Absolutely. And you're going to see this when we look at the pyramid, especially for Jordan, you're going to see just a slightly bit more males than females, okay? Typically, point number 2 here talks about it being symmetrical, which means what? It's going to look similar. It should look kind of similar on both sides. When it doesn't, it's showing us different things. It could show us a natural disaster. It could show migration. It could show war. I think in the Russia example in your video, it shows about the population and the change of male population to female at one age range is the result of a previous war and as they've aged. So we look at that symmetry. The shapes of the sides, concave and convex, okay? And hopefully you're seeing my fingers as well. Concave means that we're seeing high death rates, so the bars are getting shorter. And convex, okay, means a low death rate, and so we see kind of more of a little belly and stuff. I always have to think about that, and I learned that by contact lenses, concave and convex. Sounds like very strange, but that's how I keep them straight. Bumps, like I said, can indicate some type of change. We're also going to look at two changes that we call bumps, and one is called a youth bulge, and we're also going to look at a migration bulge, okay? And we're going to specifically look at the UAE when we look at migration because it's a great example. So when you look at the pyramid, like I said, what we see is the base, they're done in 5-year increments, and as the video said, we typically talk about up through age 14, which is child dependency, or up to age 15 right here. Okay, then they talk about a working or reproductive life up through the ages of about 45, and then they talk about a post-life, okay? And so we expect that it will narrow because people die as we progress through life. So that's why it forms this kind of pyramid shape. Now, this is an example, and I just want you to see, this is very much showing you the same thing the 3 populations showed you in the short video. Notice here it talks about what they call a youthful population. We have lots of children being born. People die off very quickly. They don't live as long, and we get a very traditional pyramid kind of shape. Okay? Then we have what we call an aging population. The example here from the video was Canada. And what we start to see is it starts to round out because more people are becoming in the work age or even in their 30s, 40s, and 50s, okay? We also notice that, guess what? The birth rate has started to get smaller, okay? So we're having less children, we're living, and we are also, what? It's thicker up here, we're living longer. And these are what we call a health transition. Then we get to an aged population. And down here with an aged population, what we have is typically a society, notice again, very smaller and narrower at the bottom. And what do we have? People living much longer, okay? And it almost becomes column-like. It's not a perfect column, but we're going to talk about what that happens and when we talk about zero growth or negative growth. Japan is a great example of this, and I think they used Japan in your video and stuff when we look at this. So what I did is this was last year's, and it's the last one we had, which is the world population, okay? And I thought we'd look here, and what you see is, notice here at the very bottom when we look at the world population, 4.5% males, 4.3% females in the birth. Just that little bit of difference. It doesn't show up really big visually on a graph, but there is a visual difference of just a few more males than there are females. And so what we start to notice, though, is, look, at every age range, we see the narrowing, right? And what we see is when we get back into our 30s and 40s, what we start to see is the men are still dying. Remember, men die more at every age range. When we get up here to about what? About 40 to 40, 45 to 50, you'll notice that all of a sudden, what's happened? We have equal distribution of males and females, okay? With that equal distribution, and then what happens? The males keep dying off, and what do we start to see? We start to see more females than males because females live longer, okay? So this shows us exactly what we've been talking about with numbers in a great visual way. They're really easy to use. Now, Mohammed, I see a hand raised. Do you have a question?
Yes, doctor. There is no big difference between aging population and aged population, yeah?
Well, we're going to see what the fine difference is when we look at actual graphs. What actually happens is we end up with zero population growth. And I'm going to talk about that a little bit further. We still, when we see aging, we're still getting a little bit bigger. But by the time we get to aged population, we typically see either zero population growth. In other words, for every person that dies, there's an equal person that replaces them, but there's not more. Or they're fewer, and so we see it actually getting smaller, which is called negative population growth. And I'm really going to show that in certain countries. When we look around the world, and when you look at this, the graph we have right now with the world, you don't see that because we have so many different type of populations put together. We have young populations, we have aged populations, and we have aging populations. So the world view gives us this nice, pretty, kind of domey pyramid, okay? But when we look by country, we'll see great variations. Does that help?
Yeah, but the youth population, you give us an exam. What's the country? You said
Japan.
for aged population is Japan, and
For aged population, Japan. We're going to look at Japan. We're going to just I'm going to get there. We're going to see these slides. Okay? You're just a step ahead of me right now. So bear with me. You're going to see more of my examples, Mohammed. That's all we're going to talk about really in the first part of the lecture today. Okay? Other questions? Daifala.
First of all, good morning, doctor.
Good morning.
Doctor, I want to ask, in the pyramid, is there usually some anomalies that makes it completely asymmetrical? Like there are some criteria or scenarios where the pyramid was asymmetrical, where like the number of males was more or the number of females was more?
Yes, and we're going to see that. I've got a couple examples of that coming up and stuff. So bear with me. You're going to see them in just a second, okay? Ayman.
Good morning, doctor.
Ayman, you had a question?
Do you memorize this number? Doctor?
Ayman? No question? Yes? No?
Do you memorize this number?
Guys, that's not a question. Do I memorize this number? You know better. It's not about memorizing the number. How are you going to memorize all these numbers? Most likely you're going to see graphs on here and I'm going to say, what kind of pyramid is this? What is this showing me? Things like that. Okay? And Mohammed, one last question and then I'm moving forward on the slides again. Mohammed, I see your hand raised.
Doctor,
Yeah.
I want to ask you, which country have the more female, more male in his birth? Do you
All
know?
countries. Typically, we have just slightly, the average is about 105 baby boys born to every 100 little girls. That's just a genetic average. I can't run you I don't know every country's birth rate, but if we go in, you'll find that typically is the average.
Thank you.
Okay? So, what I want to do is now, you all, some of you, Gizmo, you're okay. It's okay, baby. Okay, now what I want to do is I want to, so we have this expansive pyramid that we've already seen, which is a, okay, guys, can the mics go back off? Thank you. Now, Gizmo, halas. Look at me, halas.
خلاص.
Now, he doesn't know whether he speaks Arabic or English. Okay? Sometimes English works, sometimes Arabic works with him. Easy.
Calm down.
What we have here is we have the developing country pyramid. Like I said, what you see is a broad or expansive base. That's why it's called an expansive pyramid. And it has more babies being born, people die faster, and they don't live as long. The population really thins out as we get down here. Now, what I also have is, let me go into when we look at that expansive pyramid, these are the things I want you to be able to see in that graph. Go back and look at them again if you don't see them right off. We have a high birth rate. We have a high death rate. Remember, they die younger, they die quicker. We have a shorter life expectancy, okay? It's typical for developing countries, and you go, why is that? Well, they have probably lack of better access to good health care, lack of birth control, so they're not having good ways of controlling pregnancies, and things along those lines. Negative environmental factors. Think they work in working conditions that are harder, that are more dangerous, that are more taxing, as well as probably sometimes lack of clean water, okay? And down here it does say, again, poor access to health care. So these are, when we see that traditional kind of broad-based pyramid, we typically think developing countries, okay? Now, let's look at what we call a developed country pyramid. This is more of the aging, not the aged, but the aging. And here we start to see what? It starts to look, it's smaller at the bottom. We see a lot of people in the middle. And we see what? A higher, longer life expectancy. Again, women are living longer than men. Okay? Now, you all asked about a couple different things. And this is where we're going to start to see these couple of differences. We can talk about a constrictive pyramid. And constrictive just means what? We've had something happen that tightens it. Think boa constrictor, like a snake. Okay? And you can see right here, and this is not, I don't know what country it's from. It's just an example. Something happened that we had a really, so if we look here, I would say this is what, in their 30s and 40s? You know, 5, 10, 15, 20, 25, 30, okay? So we're thinking something happened. And if we look at this one, it happened to males and females equally. So more likely here, we've got something like a natural disaster happened, or where both men and women were affected equally. Or we have something like a war had happened, and children that were being born and stuff, people, both mothers and fathers moved away equally. We would have a different reason for why this constriction may have happened, okay? Like I said, most typically, think about a hurricane. When we had the big tsunami that was actually happened, gosh, about the time, just a few years after you all were born in Thailand. And it wiped out hundreds of thousands of people. Okay, a tsunami doesn't care whether you're male or female. It just wiped out that population. And now, so all those people died. Now they've grown up, and we see this lower area here, but they're still having children. So now we see it getting big again. Okay, so it can mean when we talk about constrictive, other thing is we typically have people that are aging more. Okay, we have a lower death rate. If you're living longer and you have a longer life expectancy, the death rate goes down, okay? The other thing is when we look down here, we can just see it has a low birth rate, okay? This is often, and maybe not to quite this constricted shape, not quite as constricted as this. When we looked at Canada, when they showed Canada, it doesn't look quite this narrow. But we do see this kind of figure, okay, happening. Now, it's typically the signs of a country of what we call a developed country. In other words, we have less children. We have more birth control. It's too expensive to have 10 or 15 children. The other thing is all those children are going to live, which makes it way too expensive, okay? Before I answer questions, I'm going to go ahead and I'm going to get through a couple more slides because I think it may answer some questions. If it doesn't, then I'll stop and I'll do more questions. Okay? We also have something called a stationary period. Do you all remember last week when I was talking in class, and I talked about for every mother and father we have, so two people, they have two children, and that means that they replace each other. We're not getting bigger in the population, but we're also not getting smaller. 2 minus 2 equals 0. So there's no population growth. That is what is shown with a stationary pyramid. In other words, the country's not getting any bigger. They're holding, let's say Jordan right now. You're not there, but pretend Jordan's population right now is what, 10.25 million. Stationary would mean that over the next 10 or 15 years, 20 years, you wouldn't get any bigger. You also wouldn't get any smaller. You're stationary. In other words, there's equal deaths and equal births. Migration stays stable. Okay? This is happening in countries. This is definitely what's happening when we look at certain parts of Scandinavia. So we're talking about Norway, Sweden, Denmark, areas along those lines. And it's typical because people will have only 1 or 2 children. So they kind of, one family may have 3, one family has 2, another has 1, but you don't typically see lots of big families. And everything kind of counterbalances out. So they have what they call a low fertility rate. The other thing is it starts to look like this column because what are they also doing? They also live longer. They have good health care. Remember, we've looked at that part of the world, and what did we notice when we saw the bubble graphs? At the very first of the semester, when we looked at the bubble graphs of all the countries and their health care and their income, these are countries where they have good health care. So they live longer. They have good lifestyles. They're physically active. They have less premature death. Okay? So we see this kind of squaring out. So to put this back into perspective, I just want you to, I kind of gave you a cheat sheet here. I kind of said this is what we see in developing countries and this is what we see in developed countries. When we look at these pyramids in developing countries, what are we seeing? High birth rate. Well, I've kind of defined high birth rate as being 20 to 40 children per 1,000 people. Okay? We have high infant mortality. In other words, while moms are having lots of babies, we are also having lots of babies die. I am going to ask a question real quick, and I'm going to take the mute off. Okay? At least I'm going to try. I don't know. I don't think it's on. Okay? What I do want to ask you right now, if we look at infant birth rate, can anybody tell me off the top of their head what does infant stand for? What is the infant? What age range are we specifically talking about?
Less than a year?
Less than a year. Perfect. Exactly. That's what I expect you to, not to get, but so you should have immediately go, oh, lots of babies die in the first year. Excellent. Excellent. Okay. Now, what we also have is we have a higher percentage of the child dependency ratio, and we have a lower percentage elderly dependency ratio, and we typically have a shorter life expectancy. When we look at developed countries, we have a low birth rate, less than 10 per 1,000. We have low infant mortality rates. We have a lower percentage of child dependency, but we have a higher percentage of the elderly dependent. And that's because we have what? A longer life expectancy. Okay? I've already explained zero population. Yeah.
Can I ask you?
Sure.
Are you recording this meeting?
Yes.
Are you recording this meeting?
Yes. Yes. It says it's posted. All of them record. As long as nature works with us. Okay. Mohammed, your hand is still raised while I'm at a pause. Go ahead and ask your question, please.
Okay, doctor, I will tell you what's thing. This is the first structures I see you in it, okay? Or
Ah,
react with you. I don't study just one chapter, the first chapter.
okay.
What I can do?
Okay, that's a question to ask me outside of class. Okay, while I'm doing that.
Sorry.
Right now, I'd like you to focus on class content. I have office hours. I would encourage you to come to office hours. Okay?
I'm sorry.
That's okay. I would encourage most of you, if you are new and confused, to please, those are questions that I am happy to discuss with you during office hours. Okay? But I'd like to keep the flow of the class itself still moving in the same direction. Okay? Office hours, just so you know, office hours have been changed because of the new scheduling. My office hours where I'm online to just talk to you all are now Tuesdays still from 8 to 10, which was like before. But instead of on Wednesdays, I now have Thursdays from 9:30 to 11. So any of those times I am specifically online. In other words, I'm in MS Teams. I'm not necessarily in a conversation, but I'm on Teams. So if you pop on, you can use the phone call piece. We can meet in the conference room, talk face to face. So I do encourage you to use those. Okay? Is it Lena? Lena?
It's Lena.
Lena.
Good morning.
Okay.
Hi.
Hi.
I wanted to ask about something I couldn't totally understand. Going back to the constructive pyramid, I didn't understand why we linked it to developed countries.
Because the constriction can be for different reasons. It could be natural disasters and things like that. But what happens is with the constrictive, we start to see usually longer life and lower birth rates. And something has happened that we have some changes. There's not just one type of constrictive. You can have, like I said, you can have a constrictive pyramid due to war, you can have a constrictive pyramid, and you can have a constrictive pyramid just due to economics. In other words, it's not, I think in the video they give an example of where it constricts in China, and they show specifically the constriction that happens because of the one-child policy law. And it also shows not only there was a constriction, but it specifically shows that they aborted more children. When they found out they were pregnant with females, they would abort those children because they always valued the male over the female. So there were more baby boys born than there were baby girls. If you're only allowed one child, they were choosing to only have baby boys. Okay? So there are different reasons why we get constriction.
Okay, I understand it now. Thank you.
Typically means we see more growth. And so we're kind of saying they've moved more into a developed component. And we'll come back into that in the demographic transition, because you're going to see how Jordan is kind of straddling between two areas. They're kind of straddling. We're going to see those in just a few minutes if I can get to Jordan. Okay? Mahmoud.
Hi, Doctor.
Hi.
I want to ask you something. We notice here in this population that in the past parents was like 8 or 9 children, but in these centuries most of parents like just 2 children they get 2 children or 3 children. Why in this century they use like they are using the family planning, or the health economic is affect in this British invention? British children?
It can be all of the above. You are asking exactly kind of where we're headed when we talk about demographic transition. It can be for multiple reasons, including those. Both of those, only one of them or the other, it just depends kind of on the country. Okay? It is what we find, and the very last slide I have in this presentation talks about Jordan specifically and what the WHO projected. And it talks about parents having fewer children One, because it's financially too expensive to raise more children, pay for all their educations, pay for everything that has all the health care. The other thing is by having fewer children, not only is it less expensive, but they want their children to do better. The same way your parents are all wanting you to all to become doctors, okay? They want security and they want even a better life typically for you. And that's what we see in most generations, okay? So if I have fewer children, I can do more. What?
We can put the develop in the technology as a factors.
I didn't quite get the question.
The development of the social media and the internet as a factor.
I don't know how social media really affects birth and death rates. That's not, I know it affects mortality rates. I know it impacts on suicides, especially in Western countries with young teenage girls and things, but I don't really know how social media impacts on this, okay?
Can I talk?
Who is this?
Muhammad.
Yes, Mohammed.
I think it affects by the relationship with the people, okay? And this will decrease the someone who define another girl and be a husband. In the social media, it will increase, decrease.
Okay.
You
I'm
cannot
really
meet the
not
people.
following
You
social
cannot meet the
media
people. Everything
conversation.
about
I'm very confused as to social media and where we are right now with the population pyramid. Okay? Sorry, I'm not making the connection.
Doctor, I think I get what they're meaning,
Okay?
but it's not about the birth rate. It's more about the fact that since we have the internet and the websites and development of search engines, nowadays a person can know what to do with their health and their body, so they can actually be able to have a higher life expectancy. So what they're meaning by the social media is that you can look, I think, what I think about is that when you're looking through social media, you can find posts or messages about what some people are encouraging you to do some certain things, certain good things, when I'm specifying, to increase your life expectancy, and thus it affects the pyramid in a way that maybe the person would listen and do that certain diet or that certain exercise or that certain way of developing a better mentality, so that stress, anxiety won't develop, thus high blood pressure comes, thus atherosclerosis, heart diseases, non-communicable diseases to occur. I think that's what they're trying to say.
Okay, they believe in health promotion. I've got to be honest, 20 years ago, I believed in health promotion. That's why I went into public health. I can honestly say, as we look at American populations and other Western populations, unfortunately, just because we know we should do something doesn't mean we necessarily do it. And let me just tie this, and that has to do with chronic diseases specifically, because they do take such a long time to display themselves. In other words, smoking that cigarette today does not give you lung cancer today. It's smoking them and 20 years down the road, 30 years down the road. So the cause and effect is so far in distance. And if just health promotion and health education worked, we would have the most healthy world. And unfortunately, all we're doing is we're dealing with more chronic diseases as we move forward in time.
It is an actual
I love the idea. The idea of it is, yes, that's what it's there for, and that's what we'd hope for. It doesn't necessarily mean that that's what we get. Okay? Now, guys, I know there are a few more questions, but I need to keep moving forward, okay? So give me a few seconds and because we've got to get through, my goal for the first hour is to get through this set of slides, okay? So we already know what zero population growth is. It means that we have equal number of births to equal number of deaths, okay? So that's where we get that stationary pyramid. Now, an aging population, okay? Why do I worry about an aging population? Well, Jordan is starting to age, and I can tell you that the U.S. is an aging population, okay? Let me go back and just kind of go here. What happens, again, is we get into that elderly dependency ratio, and we know that as you get older, you are going to have more health issues. In other words, we're dealing with the results of the heart diseases, the cancers, Alzheimer's, dementia, musculoskeletal disorders, osteoporosis, things along those lines, rheumatoid arthritis. So we end up having a population that has lots of medical cost. If you're a government, and remember, all of this comes back to policy. If you're a government and your population is getting older, it means you need to be thinking about two different things. One is some of that health promotion still. Hopefully, we can still stop it before it gets worse. The other thing is we're thinking about our money needs to be into those types of cares and services. Do we need to have more rehabilitation centers? Do we need to have more physical therapists? What are the things we need to support this type of health issue versus if we're talking with a young developed country and lots of children? Remember, we're talking about vaccines and respiratory diseases. So how the government's spending their money and what their policies are very dependent on how they see their population pyramid. Now, a couple of you asked me, is there a chance where you see some really strange bulges? And I said, promise you, it's coming. This is an example of a bulge. And what you notice is that in the working age, we start to see a lot of men, okay? Not the females, no change really there, okay? But we see this huge growth in males. This is typical of a country that imports its labor workforce. In other words, they bring people in because they need people to work for them during their working ages. And then notice when we get right back up to the 60s, when it gets to retirement age, they send them home. That country is not taking the responsibility of that care. So while they're looking at their pyramid and they go, oh yes, we've got lots of people, they go, oh, the large majority, we're not going to have to deal with their elderly health issues. We're going to send them back home. And this is exactly what the UAE has done. Okay? This is the UAE's population pyramid from a couple years ago. And what you see is exactly that. Notice that they are importing their work and labor forces, which is what has built the United Arab Emirates into the beautiful structures that it is. But as soon as they are past the work age, Gizmo, thank you. Once they get past working age, they no longer will give you a visa. You can't become a resident of the UAE even if you live, well, you don't become a citizen. You can become they're now offering, I think as of this week, they have finally decided to offer a 10-year residency to physicians, epidemiologists, engineering software people, and one other high demand group that they want. So we see this happening, and but when they're planning for their health care, they're only having to plan for this small, real population of Emiratis for retirement. Now, we also have something called a youth bulge, and I didn't show this, but you're going to see. Okay. About this time, somebody comes upstairs and delivers things on the floor, so Gizmo's barking at who's at the door. Gizzy, stop.
Calm down, man.
Come here.
ايه ده الكتاف هسه.
Come here. Yeah. Come on. Okay, so a youth bulge. A
Are you
youth bulge.
from America?
We have a large group of people that come into their 20s and 30s. And we're actually going to see this when we look at Jordan. Okay, so I'm going to go ahead and tell you a little bit about what a youth bulge is, and I want you to see it. Because what happens is it means we had a high birth rate, and as these people then what happens when we start to change from developing to developed country is what happens. The death rate goes down really fast, but the birth rate is still going up. Okay, and it takes a little bit for that time to balance. And as a result, we get a young population that grows up, and when they get into their 20s and 30s, there are too many of them, and it's hard to find an employment, okay? So we end up with high unemployment rates. This has happened throughout the Middle East. It's happened in Central Asia, okay? And so we're going to look at this specifically, and let's see if I can, which is Jordan, okay? So I'm going to come back to this question, and I'll ask the question after we look at the pyramids. This was Jordan in 1980, okay? The diagram on the left, and what does it show? Somebody want to just give me the basics. What is it clearly, when you look at it, one person, tell me what you'd see.
High rate. And
High birth rate, yeah.
And it's look like same male and female age and life expectancy.
Looks similar. Are they living really long? Is there
Long
a
life.
high death?
Yeah.
They have a high life expectancy.
I think like there's more young people.
If you look and we count this up really quick, you'll see that less than 5% of the population lives past the age of 60. If I count all this little 1%, 0.8, 0.6, 0.2. So what? You have a low life expectancy,
Yeah.
okay?
Yeah,
And
short
you
life
do see
expectancy.
that what? At a certain age, even when we get a little bit older, females are still living a little bit longer than males, okay? The females have the advantage. But yeah, you start to see this. So you see a huge birth rate, okay? So that's 1980. Let's skip forward 20 years. Okay, so these people are now going to be up in here, okay? And let's go to 20 years forward. Do we still see a high birth rate?
Yeah.
Yes.
Yeah. Are we seeing a little bit longer life expectancy?
Yes.
Yeah. And we're starting to see more people come into the workforce. That's a good thing. So at this point, we're starting to see it change a little bit, but we're still seeing, so the death rate is starting to slow down because guess what? We have more people living in their 20s and 30s and 40s than we definitely did here. Notice down here, what is it showing? 5% of your population was in the mid-30s. I mean, just tiny numbers, okay? Now, that's 2000. So this is about the time when you all were born, okay? So you all are down here. I know 2000, 2002, somewhere. So just you're down kind of here, okay? Let's shift forward again. I now have in the center 2016, then 2018, and then last year's, which is the most current we have. Notice here, by 2016, are we still having a high number of births?
No. It's
Yes.
low.
Yeah.
As we look through the years, it's decreasing, like
It's
from
decreasing,
0 to
but we
5.
still have a lot more births than we do anything else, right?
Yeah.
Okay.
Yes.
Okay. And what are we seeing? We are seeing the age range is still going up. So that means the death rate is coming down. Life expectancy is increasing. And we start to see a lot more people in the workforce age, in the reproductive age. Okay. So we're growing, And we're going to learn that this, if you look at 2016, we're going to learn something that this is called in the demographic transition model, stage 2. Okay? Just put that in your heads and go, this is kind of an example of stage 2. I know you don't know what it means yet, but we'll get there. Okay? Let's come then to 2018. Have we definitely, between 2016 and 2018, did we see a big change?
Yeah, a change in birth rate.
Yeah.
Yeah. Notice that for the first time, we're really seeing it starting to morph and it's starting to come down. While we still have more babies being born, it's not as big still. Their child rate is coming down. And if you think about that child birth rate we saw where the rates start to come down, this is exactly what this is showing. Okay, but we still, even as of we can grow and develop as a country economically. Now, what's really interesting is what is the one big change you see in 2019 that we have not seen before in Jordan?
Higher birth is lower.
Increasing the
life expectancy.
Look, I'll give you a hint. Where's my arrow?
Doctor, the birth rate is starting to decrease to the point that the age group from 0 to 5 is becoming much lower than the age group from 7 to above.
Exactly. It's the first time we're seeing the birth rate decrease in. This starts to say that Jordan is now at stage, what we're going to call and learn to be stage 3. Okay? That's a big transition. But here's the problem. When we look at the kids that were born that are in the 5 to 9-year-old range right now and these 10 to 14s, what we find is look where we're headed. This is going to morph up, and what's going to happen is over the next few years, the same way we've started to see these huge numbers here is we have a lot of people that need a job. And there are not as many jobs as there are people. Okay? And this is the big thing that we see, and that's why it's the first year we've seen this in Jordan. Okay? So we definitely are seeing the birth rate drop back down, come down. And this was the change of the birth rate that dropped below, because before this, for about the last 10 years, your birth rate had stayed at about 3.4 children per woman. Okay? Your female fertility rate? Yeah. Okay? Now, this past year, it finally dropped below 3. Once we drop below 3, that is why we are now seeing this change in the demographic. Okay? What this does is it changes, and what we start to see, let me go back, is we're going to start to see more people up here as we move forward in time in the elderly dependency ratio. Remember, right now we have more people in the child dependency ratio in Jordan specifically, but it will move forward. These are not hear me loud, hear me clear. These are not numbers to memorize. Okay? So don't ask me. What I want you to see is just the shift and the change. Okay? So what it does is it talks about a total dependency ratio in Jordan. And it says we've got 90 people for every dependent. So we have 90 workers for every dependent child or adult. Okay? That includes both ends of it. If we look at the child dependency ratio, most of it is child related right now. Okay? Remember, this comes back to that 35% and the 5% that we saw before. Okay? And this says for children between the ages of 0 and 14. And it says over here, if we look at children, even you all are considered dependents because most of you, I think almost all of you, It's very different than in the US. You live at home, your parents pay the bills, they feed you, they give you money to go out, yes, and do all those things. In the US, there are lots of young adults that are 18, 19 years old. They no longer live at home, okay? They are actually paying for their own rent, having a job, having to pay their own bills. So we definitely, that's why they show the two different rates, one being more traditional children, the other being children that are more adult-like as you become a college student, but you're still dependent, okay? And then it talks about something called a support ratio. The support ratio is people that just, we don't need full support we're not dependent on others. Think about having an assisted living facility. These have become very common in the US. In other words, I become older. Maybe I need to have handrails. That helps me get around. Or I need a wheelchair. I need some potential support. I need help with cooking and cleaning. Maybe things along those lines are too hard. So when we talk about support ratios, we're talking about something different, okay? We're talking about not total dependency, but just people needing help, okay? And it talks about it for all ages, and it talks about certain age ranges. All I want you to see is that this number is shifting, okay? And that the majority comes from children being dependent on adults right now. When we look at this, this is the bar, just a line graph that shows what is Jordan's total dependency ratio as of 2019, okay? And this is accounting for all children and all of those over 65. What we are seeing is that dependency ratio is dropping because as you have fewer children, you will have less children dependent. It just makes logic. If there are less children, there are not as many to be dependent on you. Okay? And with that change in lowering birth rate, we start to see that shift. The other thing is remember life expectancy. Life expectancy for people right now in Jordan is in their 70s. For you all, it's projected to be longer because life expectancy is based on what year you were born. What we're going to see is that while there's a small number now, that number will start to increase, but it will stabilize because as long as the children dependency ratio goes down, your elderly dependency ratio is not increasing fast enough. In other words, you're going to get to a point where it's just going to kind of stabilize and hold. Okay? Now, the youth bulge. What I do want you to know is that when we talk about this growing age of people in their 20s and 30s, right now, the Jordan youth bulge is about a third of the population. If you go back and add those numbers up, when you look at males and females between the ages of 20 to 40, you will find, or 45, you will find that most of them, about 35% of Jordan's population, is in this age range, which means we don't have enough jobs, okay? It's estimated that 65% of the population in this region is under 30, okay? This is what happens as a result. There's a high percentage of males who are highly educated and cannot find work. I think you all probably know this and are very aware of that. I have met young engineers that have bachelor's degrees from JUST and master's degrees from the UK, and they can't get a job. They're Jordanian and they can't get a job in Jordan. Okay? They're highly overeducated. We know that about 500 out of every graduating group for residency out of the medical schools right now, about 500 do not have residencies, no internship, no way to apply, and no job for them when they graduate. This is very different than what we have in the U.S. We control how many people can go into medical school, so we never make sure that we don't have a physician that can't have a job. Unemployment rates, 10 times higher for college graduates. Typically, what do we think? Our parents want us to get educated and want us to have college degrees and different types of degrees because the more education you have, the likelihood of having a better life and having better income. But what we find as a result of the youth bulge is that we've got a 10-time higher unemployment rate for those with the education, okay? Besides the Middle East, other areas that have been really affected by this are Africa. And specifically, I'm thinking of the country of South Africa, where they had such a high HIV/AIDS rate for years that the ratio was about 1 in 3 in South Africa had HIV and AIDS, okay? And it changed the lifespan, and it changed because the young parents were dying and the children were orphans, and now we're coming into this component of having a youth bulge of orphans that are growing up and needing jobs for them. Now, the last slide I want to show you, then I'll take some questions again and we'll pause, okay, this was the last slide. And like I said, this kind of sums up, this was written more than 10 years ago by the WHO, okay? And I took a second this morning to just highlight a couple things. It talks about the demographic transition of the country. And it says over the next 50 years, they thought Jordan's population would double again by 2035. So we have definitely seen this. And I think they're on track. If you look at the numbers, we were at 7 million at 2016. And so if you look by 2035, I definitely can see where you would be more than 14 million. Okay, we're already at almost 11. So we're seeing very quick. So there's this huge growth, okay? And it's due, and what we are moving from, and what it talks about here is it talks about you've moved from high fertility and mortality to low fertility and mortality. And like I said, part of the thing that we really see is that families' perceptions change. They have 1 or 2 children because they want to give those 1 or 2 children everything and more. Okay, so they have fewer children because they're going to invest in those children, per se. Spend time, make sure you get to go to college, make sure you get to go to medical school, make sure you get these opportunities, make sure they save money that if you want to apply and try to do residency in the United States, you can have those opportunities. So we see fewer children because they know that costs money. Okay, so they're putting that money into that expectation. The other thing is we see that people demand better care. Think about this when we're talking about COVID right now, okay? We expect better education and we expect better treatment. I expect a hospital to be fully functioning, to have certain equipment in it, to have a certain ratio of nurses to take care of me. You expect a better quality of care. That also costs money. We expect that, and that means that the government, when the government is meeting it, we have either the private sector or the government sector. That means more taxes, okay? You want better educators and you want your children to go to public school. That means more taxes because you have to pay the salaries of people that are better educated to teach your children, okay? What we do find, and what we continue to see, is the reduction in fertility rates. As Jordan starts to expand this life expectancy, we need to start thinking about what are you going to do when you stop working? Do you have enough money in the bank to cover those needs? Do we have enough insurance to cover the medical care? So we start to think about retirement. And from a government, we talk about the new labor forces. Let me just, as I'm going to close the screen down, that's just an example of, let me think, this year with COVID, what we found is we actually found that Jordan has too many young adults that are unemployed. And what did they do over the last few months? They have now put back in the mandatory military component. That is designed to provide a job, as minimal pay as it is. It provides a job and it provides an area to learn work skills that would put them into the workforce where they would not be, and they would be unemployed otherwise. Okay? Remember, they're targeting right now young adults 18 to a certain age, and I forget what the exact age is. Okay? They're replying to that component. They will expand that based on need. I know next year they expect to have like 5,000 Jordanians enrolled through this program. While you're going, that's not healthcare, that is policy, and that is designed on revenue, and that is designed, it is much cheaper for me to train you and put you into force than it is to not pay you and let you sit at home and not have a job, okay? We need that revenue, okay? We need the skills, because if we put you through this 2 years, they're hoping that those couple of years, you're building relationships, you're finding avenues. While you won't stay in the military, that will then open the door to another job, okay? So those are the ideas that they are moving through. The other thing is it provides health insurance, and it also means you're less likely to be doing things that are going to put you at risk for needing health care without having productivity. So there are lots of reasons they do that. Now, I see a couple questions. So as we got to the end of that, Sarah, your hand is up first. Sarah? Yeah.
I want to ask you something about 2019, the pyramid, the Jordan's pyramid.
Okay, hold on. Let Sarah go first. I was kind of going in order, okay? I'll give 1 second. Sarah, let you go.
Me?
Yes, Sarah.
Okay. I want to ask about the 2019 Jordan's pyramid.
Okay.
You said there was a huge change in this pyramid with the childbirth rates.
Yes, if you look at the very bottom, I've got to open the slides back up. Sorry. I probably shouldn't have deleted some slides.
Doctor? Can we take a break for 5 minutes?
I'm gonna. We will break in just a couple minutes, okay? I'm going to answer these questions, then we'll take a 5-minute break, and then we can come back, okay? You asked about this, so let me share the screen. And please, it's going to freeze again. I can see it. Yes, while I'm waiting for this to pop forward, and I'm not sure it's going to, if you look at the 0 through 4, what you see and the largest change is absolutely, it is the birth rate. It's the first time the birth rate is actually coming in and getting smaller in the 0 through 4 population range, and that is the most important thing that we've seen change in Jordan. Like I said, it really does happen. Status. Pardon?
Why did that happen? Like, what caused the change?
You all are moving, you are really moving demographically into a more developed country. This is what we call the shift of the demographic transition, which is where we're going to be talking about next. You become more stage 3, which means you are, and it's just that last slide where I talk about family changes, structure changes. People start family planning, birth control. Women have more opportunities to work, so they have less children. They have roles that they can do besides being at-home mother and stuff, and that is part of a cultural shift. Okay?
Yeah, okay, thank you.
You're welcome. Okay, I'm going in order of the hands. So guys, I'm going to go in order. Daifala.
Doctor, about the graphs of Jordan, is there a certainty at some point we will reach a stationary column?
Possibly. Yeah.
My next question is about the population. So, as you were saying, by the centuries and the years that we are moving on, people are just like giving low births, like they are getting less and less children. And by like at 1980s, we can say that they had 7 children. People were used to have 7 children. Now at like 2015, 2016 to 2020, people are like getting to a maximum of 2 to 3 children. And yet here we are having the total world population increasing. How does that even affect?
Because it's just your 0 to 4-year-olds right now that we see the number decreasing. And actually, that really is the demographic transition model where we're going. What happens is you have a drastic change very quickly. When we talk about that expansive pyramid and you have all the babies being born and people having low life expectancy, okay, and lots of deaths. So while they're having lots of babies, if you notice on those pyramids, they go up when it's a pyramid like this bottom part disappears very fast. There's still while they're having lots of babies, there are lots of babies actually dying. They have a high infant mortality rate, as well as they have a low life expectancy. Okay? What then immediately happens, and what you see with Jordan when it happens, is all of a sudden things start to get better and life expectancy goes up and people are living longer. Okay? So the pyramid is still a pyramid, but it starts to move more like this. I'm assuming you all can see my hands. I'm under the impression that I'm on camera and not my screens. Okay? I'm not seeing anything. But okay, so you go from this, you start moving like this. Okay? As you move like this, what's happening is your death rate is going down. In other words, your mortality rate is decreasing. So all of a sudden, we have more people moving into that work range than we had before. Babies aren't dying. Your infant mortality and your child mortality rate is decreasing as part of that component. Therefore, you get that growth. Until we see what just we saw in 2019. So for the next 20 years, you all are still going to have the same problem with employment until those 0 through 5-year-olds right now start to reach working age. Does that make sense?
Yeah, it does make sense. After all, like Jordan is having a crisis of unemployment and people are like struggling to find work at the end of the day.
Yeah. And so the other thing is Jordan stabilizes because you have a lot of people that actually leave here and go. It doesn't really show as much as I thought it would, but you have enough of the population that actually migrates for work. But you kind of do it as a whole group. So in other words, we don't see it strictly as men leaving. Typically the family goes. Does that make sense?
It's not as an individual, it's like the whole members of the family are leaving.
Exactly. Unlike the UAE where they just bring in those migrant labor workforce.
Yeah.
Yeah.
For residency and like for work of constructions and for making skyscrapers.
Exactly. And if you've seen how they live, it's a little scary.
I did.
You did? Okay, I have to, and it really does. It's yeah, that's another subject altogether.
Mm-hmm.
Okay, Lana, now is your turn.
I wanted to ask concerning the child dependency rates. They don't really make sense for a country like Jordan, when people would depend on their parents until they reach, for women, they could depend on their parents until they reach their 30s or until they get married. So child dependency rates, I don't think they make a lot of sense for a country like Jordan.
I understand what you're saying, but we still have to talk about, and yeah, you're probably right, and stuff. But we still compare it to the rest of we kind of put it out there so we can get a feeling of what percentage of, on average, we don't think about the cultural implication. We're just thinking about globally. Can we compare most people that are of the workforce age versus children's ages? And typically we talk about child labor laws as being kind of the cutoff point. There are still people here, I've got to be honest, guys. You all live a very privileged component. There are people here that in their 20s do get married and do have children and do have jobs and other things that they have to, So I understand both sides of it. But yes, I understand what you're saying. There is thought to that. Ahmed?
Hello, doctor.
Hello.
My question is that in the 2019 diagram, the decrease in birth rates, you said that it will create a bigger crisis in needing more people to work or more workforces. But it is already exists, and how is going to be the country policy, if you can expect it, to deal with this problem, and if it continues to if Jordan continues to get lower and lower in birth rates, does that mean like in like 50 years is going to be everything okay or not?
حد يسألها إذا بتعطينا بريك ولا لا.
I wish I had the ability to have a crystal ball and tell you. Typically, and we're going to come back to this. You ask a really good question. Remember, these are models, okay? They can change. Things can happen that cause them to shift radically. That being said, if we use this as a model, yes, it's a good forecast for where we're going. There needs to be some kind of way, and here's where you're really crippled. COVID has crippled the economies of the world, okay? It's not just Jordan. It's every country. Like we said, the only country that has a positive growth this year is China, which is really interesting. That they were where it started, and they were able to control it and bring back their economic growth. They're the only place in the world, okay? So Jordan is not unique. It's just, it's hard. That being said, I don't have the real, like I said, if I had a crystal ball and could tell you, I would, but I don't. We do use it as a model. It does indicate that things will be better, but the problem is you really have to figure out how to employ your current workforce. Because what happens is we need everybody in this current workforce age range to be working. Because if they're working, we're building tax revenue, which will take care of them. And we're thinking about policies of, remember, as you get to be an older society, we have to have enough money to take care of you when you get old, and you really do cost us lots more money. You follow? So would it make it better? It will make it better in the sense of employment, but if we don't figure out how to employ everybody now, what happens is we don't get the luxury of building the revenue from all those workers to take care of you later from a policy standpoint. So this becomes a different conversation out of health policy and becomes one of economic growth, and how do they bring investors into Jordan and bring more jobs into Jordan right now. Okay?
But also, if we had like enough money to, if we, let's say that we have enough workforce for like the work age rates, doesn't that mean that we will get more like healthier policy for retirement people? So that will high up our death rates also. So it's going to be like the polls in Japan, small birth rates and like bigger death. Small birth rates and also higher small birth rates, higher death rates, and the between is going to be like flipped pyramid. Isn't that right?
It can be. Japan is under a very interesting demographic. They have, remember, Japan as a country has the longest life expectancy there is, first of all, which is really interesting. And they have the oldest demographic factor. As far as life, besides life expectancy, they have the elderly the age population. they actually have had to put incentives to women to get married and have children, because what has happened is women don't have an incentive to get married young and have children. They have careers, they have friends, they have a life. They've learned to have that independence. And there have been things that they're putting into place that offer women incentives to get married and have children now, because they recognize that they're not going to have enough workforce down the line. And that does become a problem. The same way in the United States. Let me tie this back to very strict health policy. If you remember, in one class, I just briefly mentioned that the U.S. has, when you get to be 65, we have something called Medicare, which is an entitlement program, which means that everybody, once we turn 65, we get a certain type of health coverage, okay? We've paid into this system with our taxes throughout our life, okay? But we don't pay enough in that it really covers what we spend. We're kind of taking money from those that are younger from us right now and paying into the system to cover the current cost. There has been always a question as to when Medicare will go bankrupt, because we are taking, instead of the money I put into the system covering just my cost, my money covered people from 20 years ago. Does that make sense? And the same way, when I get to be 65, my money's been used for people that are sick right now versus, so it's not building interest. And this definitely gets way too far off subject, but it definitely affects policy. So what you're talking about, we see this in countries all the time as this balance. And part of that has to do with trying to set up a system later in life. And Medicare was designed, it was started in the 1960s. When they did that, they said at 65, we'll do this, life expectancy for the average American was 72. We could afford 5 years of cost. But when life expectancy came to be in the early 80s, we weren't collecting enough money to take care of people for 15 and 20 years. We were paying enough in to take care of somebody for about 5 years. And this definitely, so we watch these pyramids and these flows to kind of say, what do we need to be planning for in the future? So you're asking the right questions, okay? I've got 3 questions right now. Miriam, Bayan, and Al-Farouk. I'm not sure if I'm Al-Farouk.
Al-Farouk, yeah.
Farouk.
Okay. You all will ask 3 questions, okay? Then we'll take a break, and we have 1 slide we need to do when we come back, okay? So, Miriam.
Doctor, I want to ask you, how do you expect the population pyramid to change in Jordan after 2020 and with the presence of coronavirus?
Ooh. Well, I think we're going to see it shorten. I have not looked at your age demographics of the population that is dying in Jordan. Well, I think most of you saw the posting we put in that OWN gave us the link to. I would really encourage you all. While I posted the Roya News piece, OWN sent us the link from the International Federation for Health that actually does the demographics. Guys, it's like 4 graphs that are so cool, because it literally is showing the plots of how we can change the mortality rate specifically in Jordan for using masks and using social distance. And you can see what they expect the mortality rates to be if we keep doing what we're doing. If we get better compliance with mask use, or if we get better compliance with social distancing, how it shifts, and you can literally move it through time. Gotta love technology. So you ask a really good question, Miriam. My thing would be is it depends on what we see change. The projected deaths right now really are projected to be about 6,000 deaths over the next which is, guys, right now we're at what, about 1,200, 1,250, if I stand correct. We're talking about 5,000 people dying in the next 2 months. If they are predominantly elderly, we're going to see, which is what they are, that life expectancy pyramid comes down. So we see the narrowing at the very top and stuff. That's all I can project right now. I'm not any better than that. Okay? I wish I had a better answer. We stay tuned and we watch. Okay? Bye-in.
My question, if it's right or not, we don't have the perfect shape of pyramid. It depends on the country. For this, we can't decide that if the increase or decrease in birth it's good or not, right? Like China and Egypt.
And so and definitely, we look from country to country. I encourage you, go back and watch the video, and it shows you different countries have different patterns. And there's not necessarily a good or a bad. I don't want to equate things of being good and bad, just as it creates different issues or different situations you have to address and stuff. In other words, dealing with children's issues means we're dealing with children's issues. It helps us figure out what policies we need to be focused on based on the age groups. With you all, because we see this big growing group in their 20s, 30s, and 40s, we definitely, going back to the very beginning of class where I said, I wish health promotion and prevention worked as well as it did, we really still need to be focusing on that because we still have the time. Once you get to an older population, your 40s, 50s, and 60s, that promotion, you've already done the damage to your arteries. You're already hypertensive. You already are diabetic. You are no longer pre-diabetic. So we end up with different health issues. So it definitely tells us what policies and what we want to spend time on doing. Okay? Now,
my cat.
Okay. Alafru.
Hi, doctor. Good morning.
Hi.
About the decrease in of birth rate.
Yes.
I think actually it's an economic problem more than it's another problems. According to the latest government data, Jordan debt rose to 44 billion. We have no jobs, nothings. The women problems that they don't want to be a housewife. It's actually a small issue in a field of problems.
Yeah, that is a small issue in the field of problems. Yeah, there is very, like I said, this moves us out of just health policy and moves us really into economic development. It is not my forte. It is not my knowledge base. It's just my life experience. So I'm not an expert to talk to that, but we can all talk about our life experience and our perceptions. So, yeah, there are definite, Jordan has problems. And if you think it doesn't, you've been very sheltered, and that's lovely, but it does have problems. But every country has problems, okay? In the U.S., we've got problems and stuff. Ours, a lot are political, but we also have health problems. We have total denial that we have become the most obese country, that we have a high rate. We have children with type 2 diabetes. This is a disease that no 20-year-old should have. And we have children with type 2, okay? We have people that don't understand the diet components. We live off of fast food. And what's so funny is as countries westernize, a lot of them adopt a very bad diet. They think fast food is lovely, and it's the worst thing for you, okay? McDonald's is not going to make you healthy. It may taste good at the moment. Okay, they have really good hot, salty fries from McDonald's. I'm sorry, I am American. Nothing beats them. But it doesn't help your cholesterol. It doesn't help anything else. Okay, and people seem to think that that's Westernization. I don't know if many of you have traveled very often to Thailand or that part of Southeast Asia. They consider Kentucky Fried Chicken a middle-class establishment, and everybody wants to go to KFC. Okay? Having fried chicken is not from KFC is not a healthy food option. Okay? I'm not saying don't eat these foods ever and things along those lines, but we definitely see shifts that are not positive when we look at health changes as countries westernize. Okay, guys, it's 10:30. What I need to do is, I know you asked for a break. Do you all, let me ask you this, because it is 10:30, I have literally one slide that I want to talk about. It will probably take, let's take a 5-minute break. So at 10:35, I'm going to literally stop the recording, okay? I'm going to shut it down for I'm going to stop recording for 5 minutes. I will come back in. We will record the last 5 minutes. It is one slide that you have not seen. I made it specifically for you, okay? So we're not going to start Unit 5. But if you want to find it in the 5-minute break, if you go into your class materials folder, you will see something that says prevention, okay? That's what we are going to talk about, and it is just one slide, okay? So you can go into the class materials folder to find it so you don't get panicked and ask me where it is. Let's take a 5-minute break. We'll start back at 10:35, okay? And you all have been great today. Thank you. So I'm going to mute myself so I can go get some more ice and turn off my camera, and we'll talk in 5 minutes.
تنفسوا يا جماعة تنفسوا.
تليفونات.
ماذا تعمل بعد البريك حكت؟ هي آخر
الشاب اللي شغل قرآن، الشاب اللي شغل قرآن يعني أنت رعبتها راعب يعني صفنك.
ايش فكرة
صراحة صحاني صريح صحاني
والله مين حطوا عن جد ايش تعملوا؟
كم عربي هاي بتفنص علينا.
بعد تشرح سلايد خارجي ولا من السلايدات اللي معنا؟
لا سلايد
خارجي.
عن جد بدها تضيع نص ساعة سلايد خارجي وبالآخر تحكي لنا اقرأوا قراءة.
جمال الخارجي مش داخل بالمرة صح؟
بس إنه المحاضرات اللي قبل إيش كانت تعمل؟
السلايدات أيوة الخارجية.
تسمعوا المحاضرة؟ مش عارف أنا يعني. واحد ميوت أنتوا خلاص.
مطلوبة هاي سلايدات.
هي معنا بالامتحانات.
الو
يا جماعة السلايدات الخارجية معنا بالامتحانات.
هسه النساء معانا فهم قالت فهموها فهم ما بعرفش ليش.
يعني رح حجيب أسئلة عليهم ولا لا؟
احفظي لا ترديش 70 سؤال والله لا تموتنا احفظي 60 سؤال.
هاي الصافي.
من وين نجيبهم السلايدات الخارجية؟
مؤمن حبيبي أنا
مؤمن
اخوي الشيخ مؤمن يا حبيبي وقف في القرآن ترى الواحد بس
الو اخوان وين الدكتور راحت؟
بريك 5 دقائق.
شباب بتعرفوا احسن شيء انه الدكتوره ما بتفهم عربي.
سبحان الله ما تزهق هاي تدريس.
مترجم
تلقى خلاص
جماعة الخير مش انا مش دارس شو اسوي؟
كلنا مش دارسين.
كلنا زيك.
مش حدا دارس.
بس تيجي اسمع، بس تيجي شغلوا قرآن.
لا بس تيجي شغله مجوز، خلينا نجرب.
انا بشغل.
حطوا
حطوا الهدف مرصود والرشاش جاهز.
اسمع اقول لك
الهدف مرصود والرشاش جاهز. حطوا.
اسمعني خليني احكي لك. كنت بدي اسالها
حطوا لها مهرجان.
اسمع.
الو
يا اخوان انا عندي سؤال بس قبل ما تسووا اللي بدكم اياه.
ما حدا يحط اغاني، ما حدا يحط اغاني ولا اشي يا جماعة.
اخوان لا حد
والله اسمع. كنت بدي شباب المحاضرة مسجلة.
الو
كنت بدي اسالها لما فازوا بالانتخابات الامريكيه جو بايدن شغل هذا مقصود. يجي على بالي السؤال.
الو حدا سامعني؟
كل سامعك.
لا بلاش هسه عن نبلع نيد، كلنا ناكل.
شباب بس بالضبط. اي احنا ابلع.
غاز وبوس لي راملها.
بس هذول اللي تبعون امريكا ايش؟
طبعا انا فكرت انها المحاضره مسجله.
مسجلة. يعني مش مفضلين بالمد بدون اغاني.
المحاضره مسجله. يعني مشغلش كويس.
والله غير اليوم كل المملكه تلاقيها تتفرج علينا. اصبروا علينا شوي بس واحد يشوف الفيديو على اليوتيوب ويعمل له قص. يا الله.
لا ما هم وقفت.
الدكتورة حكت انها وقفت التسجيل.
وقفت معناته خذوا راحتكم يا شباب.
بس لا الله يبي جاهز.
مع عن جد رجع يكرر حلقة القرآن والله عيب.
في تسجيل.
دعنا
بس بيض مشان الله.
وقعنا حقنا.
كومستير كبسة.
امبارح
شباب احنا بس
شباب في واحد بيصيح معنا.
Okay.
دكتورة
خلص هذا المقطع عمل له اختصاص هيك دبروا من عنده.
هسه الدكتورة حكت
And I'm going to start recording this one more time. Okay. So hopefully this has started to record. And what you see is one slide and stuff. I want to take a few minutes. I have not covered this. And I realized I had not put it in any of my slides this semester. Okay? I do expect us to be able to talk about this and you all to give examples. I want to talk to you about different types of prevention. If you remember when we talked about what was the goal of public health, and we talked about, and some of you have asked me about health promotion versus prevention, and we talked about treatments and things like this. From a public health perspective, this is different than other things, but from a public health perspective, we always talk about there are three kinds of prevention, okay? As you can see here, we have primary, secondary, and tertiary prevention. Primary prevention is exactly what I'm talking about when we talk about eating a healthy life, eating a healthy diet. Okay? When I talk about not smoking, things along those lines are the things we are talking about with that component. Okay? Now, when I talk about secondary prevention, I am talking specifically, I don't need to have my hand raised. I'm having fun over here. Okay. I am talking about screenings and I'm talking about treatments. Now, all of this, why am I spending time talking about this? Because we're going to talk, I want you to understand the difference between these tied to prevalence and incidence. Okay. The third type is what we call tertiary prevention. Prevention is,
دكتور
I know, I'm going to mute everybody. Okay. Tertiary prevention is, my tongue's not working, is strictly when we talk about trying to improve people's lives after they have been sick. Okay? So if you look at this slide, primary, and I put two different images on here. Guys, it's two different ways of explaining the exact same thing. Some of you may like it where it looks like a sliding scale, and you talk about being healthy. So primary prevention are the things we do before while we're healthy to keep us. Secondary, like I said, is about treatment and early detection. And tertiary is once you've been sick. So going to physical therapy, having rehab after a heart attack, that would be things that follow in tertiary prevention. Learning how to read Braille if you can no longer see. That would be tertiary. Secondary, having a mammogram for breast cancer. Having a PCR test for COVID is secondary, okay? Those are tests that are designed to detect if you have the disease. Anything that tells us having your blood sugar checked, okay? If it comes up over 100, you're diabetic, okay? We know that's secondary, so we're going to treat the disease. If you don't like looking at it this way, you can look at it as a pyramid or a triangle. Primary, we're talking about all the things we can do that prevent you from ever getting sick, okay? I can talk about wearing a seat belt as a way to prevent injury. That's primary from a car accident. It doesn't mean it's always going to work, but an airbag, that seat belt, following the speed limits, using my signals, those are all primary behaviors designed to prevent me from what? Being in a car accident where I need medical treatment. Secondary, we're talking about if I give you aspirin, if I give you ibuprofen, if I give you medication, like I said, any screening test that diagnoses you as having a disease. So secondary picks up our incidence and our prevalence. Primary is designed to reduce incidence. Tertiary, if you go back and think about the bathtub, is designed to get you out of the prevalence pool. We want to move you from prevalence back out. In other words, we want to make your life normal as possible. Okay? I'm going to unmute you, and I would like a couple of you all. I think you're unmuted now. Okay. Can you please tell me? Somebody wants to give me a different example of primary prevention.
Doctor, there's.
Did I follow? Yes.
How about like checkups for cancer? Like every 6 months to a year, people check up for cancer, and like if somebody have cancer, then the secondary and the tertiary prevention starts to occur. As an example.
If I'm doing an actual screening, I see lots of hands coming up. If I'm doing an actual, if I'm doing an actual screening, I'm detecting cancer. It's secondary. If I'm talking about eating 5 fruits and vegetables a day, that's primary to prevent colon cancer. Okay?
Mm-hmm.
If I talk about not smoking, that's
lung cancer prevention.
Immunization.
Immunization, absolutely. Whoever said that, bravo. Immunization is exactly primary prevention. Okay, so I find it very interesting when we talk about COVID, everybody's hopes are on primary prevention. Okay, but nobody wants to do the other types of primary prevention, which are wearing a mask and social distancing. Those are both primary prevention. They're designed to what? Reduce your risk of getting the disease. Yeah? Okay. Who else wants to give an example? I see lots of hands.
Doctor, for COVID-19, maybe washing hands.
Absolutely. Absolutely. Washing hands. Okay. Who wants to think of a different disease? Can anybody think of something different?
We can take regular vitamins.
Taking vitamins. Okay.
Using physical activity.
Miriam. Miriam or Ahmed? Okay, Mohammed.
Vaccines.
Vaccines, absolutely. All those that we do. Okay. What about
COVID-19.
what
Wearing
about
masks in
wearing
COVID.
masks? What about physical
Suicide
exercise?
hotline.
Increasing physical activity.
Exactly.
Fluoridation for drinking
Walk.
water.
When we talk about reducing cardiovascular risk, when we talk about reducing diabetes, reducing your intake of sugar and white foods. So all of those are types of primary. I know there are a lot more hands raised where I see a lot of people going, I can give one. Who from those hands? I'm going to go to Mohammed is next on the list. Can you give me an example of secondary prevention?
Stroke.
Okay, what about how do we prevent? What's secondary prevention? North?
Vision screening.
Hospital treatment.
Vision screening. Hey, that's great. Absolutely. Whoever said vision screening, absolutely. When we test your eyes, because we're doing a screening, and if you have an eye problem, we are going to treat you. So that's a screening. So it's secondary.
Chemotherapy.
Absolutely. What else?
Chemotherapy.
Yes, chemotherapy. Totally other end, but absolutely. What are we doing? We're treating cancer. Okay?
Yes. If you have a coronavirus, go to quarantine.
If you have coronavirus, getting remdesivir, we're using medications that don't treat the disease but treat the symptoms. But yes, that's secondary prevention. We're still trying to reduce the likelihood of needing what? A ventilator. Absolutely. Okay?
Aspirin for the heart attack.
What about a heart attack?
Aspirin to the heart
And actually, we can be doing that as primary, secondary, or tertiary. Okay? And you're going, oh my God. Because we can give people where they have bad cholesterol, the doctor may give them aspirin, which is a blood thinner, to try to prevent them from having a heart attack. We give it in secondary to keep the blood thin. And we may give it after their heart attack for a while to keep their blood thin to prevent them from having a secondary heart attack. And actually, we know aspirin for tertiary, for secondary prevention of a second heart attack is very effective. So we could use that one in all three stages. So yeah, okay.
Doctor.
Mm-hmm.
Doctor. Fever.
Okay. Whatever we do to treat the fever, if you give you medication for a fever, like ibuprofen to bring the temperature down, we could be talking about giving somebody an ice bath if they're really cold. I mean, really hot, where they have to actually lower their body temperature and put them in a physical ice bath. Okay? Yeah. Okay? It sounds like you've got this. Who wants to give me an example of tertiary then?
Chronic disease management.
Okay, being what? Be specific. You're absolutely right. Give me an example of chronic disease management.
Diabetes.
Injecting insulin.
Arthritis.
Injecting insulin. Okay? Okay? Trying to get you back to normal. Think about this. Anytime you've had muscle atrophy, where you've had a cast on something that's been broken, and you have to go to the doctor, and you have physical therapy to get your muscle strength back, that's part of it. Having a new diet. We have a cardiovascular diet that we put somebody on after they've had a heart attack. If you talk about somebody that's had a stroke, they may go to occupational therapy. That's specifically the type of therapy that will help them learn to what? A speech therapist, maybe they need to learn how to re-speak. Maybe they need to learn certain muscle coordinations and how to redo things. When I was a very young girl, my grandfather had a stroke, and I can remember him I was young enough, I was learning to read, and he had to learn how to read at the same time with me. So we would read books together. I was about 4 or 5, okay? So he was having to learn, and that would be an example of tertiary prevention, which is a rehab. I see lots of other hands. Are these all to share examples or to ask questions?
Wearing protective
I have an
glasses
example.
after lasing surgery is a tertiary prevention.
Hold on. Okay, I heard one person say they have a question, but somebody said something about laser surgery. Can you repeat that so I can hear it to make sure it's right or not?
I think wearing protective glasses after LASIK surgery is a tertiary prevention.
Sure. Absolutely.
Doctor, I think like rehabilitation programs.
You think what?
About the rehabilitation programs.
Rehabilitation programs. Those are
Doctor,
exactly.
how about 6 months apart regular checkups for cancer after the treatment, after the end of the treatment, if it was detected by a surgery or chemotherapy?
Okay. So absolutely. So you all understand the differences between primary. Gosh, you all are good at examples. Much better than my class last year. So this is something that I did want to cover because I can promise you, I will give you different examples and say, what type of prevention are we looking at? Or if I'm doing this, what am I focused on? If you think about this is the last thing I want to finish with, okay? If we're looking at primary prevention, we are really trying to reduce incidence, okay? The whole idea is if we reduce incidence, long-term also, we're immediately reducing incidence, but long-term, we reduce prevalence, okay? When we talk about treatments, we are talking about we don't change incidence at all. So secondary prevention does not deal with incidence at all. It solely deals with dealing with prevalence. We're talking about a way to get them out of the prevalence pool. Tertiary is also focused on once we get out of treatment and out of the prevalence pool to keep you from going back into it. Remember, you saw how water could go back into the tub where they talk about reoccurring? That's where tertiary is. It's trying to make sure you get back to normal as soon as possible. Okay? Next week, I think we are going to have the review for class. I had hoped to do, and I'm not sure how this is going to work. I just want to finish with that statement. I had hoped to get into Unit 5 before the midterm. I'm not sure I'm going to have that luxury because now we have 2 classes. This is your class for the week. Aren't you thrilled? You're like, oh, health policy is done this week. Wow. Okay. So what do you need to start to do? You need to start reviewing. Okay. Because next week we will have your review for class. Okay. That's all I can do. It's the only date I know we're going to get you all together that I can do this with you all. I'm more concerned about my other class. So at this point, please go back. If you are new to the class, make sure you're going back and watching the old lectures, taking notes, asking students other questions. Make sure you can calculate incidence and prevalence rates. Terms that you're not sure about. It will be a question and answer session. I may talk, actually, I think what I'm going to do, since I have 2 hours, I am going to talk about the first few slides in Unit 5 I'll do about 30 minutes of lecture, and then we will go strictly into a review. Okay?
Okay.
Good? Thumbs up?
Okay.
Okay, okay.
Okay, Doctor.
Are there any of these hands that I'm If you don't have a question, if you'll put your hand down. If you have a question, I can take a couple minutes. For those of you that are through, you're through with me. If you don't have questions, you can go. Have a lovely rest of your week. For the few of you that may have questions, I will stick around for about 5 or 10 minutes to answer questions. Okay?
Okay. Have a nice day, Doctor.
You too. Enjoy your week.
I wanted to
And
ask
stuff.
about the date of exam.
Okay?
Doctor,
Yeah. Question.
Doctor, I have a question.
Okay.
Sure. Do you think coronavirus is going to die after treatment or no?
بس مسحتيني اسمي.
No.
جايز احكوا لها بنقدر نطلع ولا لا؟ عنا لاب.
يا نطلعوا
قالت لك تقدر تطلعي.
Doctor, can we leave because we have a lecture now?
Yeah, I told you, my class is over. I was just answering a few questions for those that had questions. I've told you, you can go.
Thank you.
We're done. I'm
Thank
just answering a few questions. You're free to leave.
اطلعوا.
Okay?
يلا يلا طلع برا.
So for those of you that want to go, you're done. Bye.
Bye.
Okay. A couple of you wanted to ask the quick question. What was the quick question?
Have a nice one, Doctor.
Have a nice day, Doctor.
Bye. Was it? Bye-bye.
Have a nice day.
Best wishes.
You too. Did anybody have any questions or everybody's gone?
No, there are students who are raising their
I had a
hands.
question.
Okay.
Doctor?
The question, it's not loading fast enough for me right now. I'm at a real slow pace, so just talk. I'm not going to be able to run through the list.
Yes, I wanted to ask how is
Okay, I
tertiary
see
prevention?
Amar lit up.
Can we see your dog?
Can you see my dog?
No.
Yes, you can. Yes, Mom. Come here. He's like, no, he doesn't want to talk. Hold on. Yes.
الوالدات الخارجية هذه مطلوب منا.
ولي يا زلمة هذا اللي همه.
There's Gizmo.
دكتور
هذا حرص اللي عامل الأزمة.
There's Gizmo. What's the other question? Now, serious questions. Yeah.
Right by Doctor.
Any questions about the
I
lecture?
wanted to ask about the tertiary prevention. How is it supposed to decrease the prevalence if there are chronic diseases?
Decrease, because the idea with tertiary prevention is we want to get you back to as normal as possible. Example.
Doesn't eliminate chronic diseases.
A lot of them it doesn't.
Doctor,
In other words, if I'm diabetic and I take medication, I probably take it for the rest of my life. It doesn't work on that one, but it does work for other things.
Doctor,
we can talk about patients having a cure rate. And typically, if you're more than 5 years out of cancer, we will talk about being cured.
Doctor, can I ask a question?
Yeah, but I was answering this question right now. Okay, let me finish answering this one. Hold on, let me finish answering the question that was asked. So
do you think the coronavirus will last for a long?
Okay, let me finish answering the first question that was asked, please. Okay? And I'm sorry, I don't know who asked it because it's not lighting up. All my screens are frozen. I just am hearing the questions. Now, when you asked about tertiary prevention, so if I pass the cure rate or the cure stage, which is 5 years, which comes out of most cancer societies, it means that I've left that prevalence pool for good. Okay, and that is technically an NCD. I can come out of hypertension. We can actually, some people can be treated, and if we get them physically active, we can get their hypertension down, and with diet and other things, and we can actually make them so they are no longer hypertensive and needing medications. It's not a whole lot, but there is a group that actually, once we get the weight down, once we get the exercise going, we actually see them and they leave it becomes no longer, but they continue to do that. Does that make sense? So we definitely talk about
Yes, it does. Thank you.
You're welcome. Okay, now there was another
Have a good
question.
day.
Doctor, the last question.
Yes, about COVID.
Does the vaccine you usually get a chance to
A chance to what?
does this vaccine you usually get a chance for to manufacture it?
You know, they are working on that right now. There's the conference that I gave you all the free link to, which is with the head of Pfizer. It's not Glaxo. It is Pfizer tomorrow. I don't know enough about their whole things, but they have talked about its effectiveness and everything else. I know I'm going to listen tomorrow evening to it because I'm really curious to hear what they have to say. I mean, these are foremost authorities on the vaccine and the vaccine development. If it's really that effective, I hope we all are able to get it. There's lots of logistics to it. Okay? Other questions?
Does fetus screening count as primary or secondary prevention?
Secondary. Anytime you say the word screening, immediately go secondary.
But you didn't give birth to the baby yet, or like...
But hold
so
on,
it did not
we're
happen.
trying to detect disease. We're not trying to prevent disease. We're trying to detect disease. So if we get a positive, you are getting treatment. Does that make sense? So we are detecting disease early. The same way a pap smear for women is a way of what? They take the pap smear from the cervix, they run it through to see if you have cancer cells. It's a screening. If you have so it's trying to detect cancer before you have signs and symptoms. Screenings are often used. Think about this, the PCR test with COVID, it is a screening because what is it doing? It's figuring out, it's really, especially for those that are asymptomatic, it's telling us you have this disease even though you don't have signs and symptoms.
Doctor, I think she meant the screening for babies that are still inside their mothers. How to, like, the screening at this point is not a secondary prevention, I guess.
Yes, whether you should have an abortion or not, depending on the baby's
or taking
condition.
medication
like
for
what
the
if
baby.
it's not treatable? What if you just want to
They're
know
still
before?
doing a diagnosis. They're telling you that baby has Down syndrome. They're telling you it has some other chromosomal abnormality. They're diagnosing a condition. I don't really like I wouldn't use that necessarily as an example, but it's technically, they're diagnosing the unborn child.
So it is still secondary.
So it's still secondary, yeah.
Hi,
Okay, thank you.
You're welcome. That's an interesting question. I'd not have had somebody asked that before. Thank you. Okay, next question.
Hi, sir.
Hi.
So I want to ask that what happens in Jordan now is a tertiary prevention. I want to ask if this right or not.
What do you mean? You want to ask about Jordan in what way?
What happens in Jordan now about COVID, and in the start of the pandemic, all things in the country is locked down. And I think that was a primary prevention of the disease. And now everything is open one more. And in every week, we have a lockdown back. And I think that is a tertiary prevention. They want to improve our quality of life. And in the same time, they want to decrease our symptoms, our symptoms.
No, don't think of it from that angle. You're definitely muddying the waters. No, we are strictly talking about put it into individual perspective, because when we do this, we're really talking about individuals. Okay, we may do something on a broad scale, but it's an individual impact. Lockdown has nothing to do with tertiary prevention. We're not
Doctor?
talking about those that have the disease.
Can I ask a question?
Yeah. Yeah.
Do you think that the disease will last long for the next year?
I think we have the need to wear masks and socially distance is probably for another year.
Doctor,
Yeah.
we said that chemotherapy is a secondary prevention. Isn't it a tertiary prevention? Because we do chemotherapy after the cancer occur, not while developing it.
Cancer. Chemotherapy is used to treat cancer the same way the radiation is used to treat cancer. So no, it's still second. Anything we do as treatment is thought as secondary. Tertiary is about after you've been sick and what we try to do to make you back to as close to normal as we can. Okay? We don't always get back to normal. Does that make sense? But we're definitely trying to get to normal.
Okay, doctor.
Okay. Doctor, this is going to be the last question I can answer right now because I do have some other commitments that I've got to go and stuff. I'm obviously will be here tomorrow for office hours and on Thursday for office hours. Okay. Let's make this. This is the last one I can do right now. Okay.
I want to ask a question.
Okay.
Doctor?
Yes.
I wanted to ask about tertiary prevention. Does it have to be a chronic disease? And we're reducing the symptoms of a chronic disease?
Absolutely not. Absolutely not. It makes more sense when we talk about somebody that's been in a car accident. And when we talk about after they get out of the hospital, they still have to go to a physical therapist, or they still have to go and get certain types of treatments to help them still get back to being themselves. When we talk about what else? What other kind of things? Infectious diseases. After, let's say you've been really sick and you're really weak, learning how to get your muscle tone back, just getting your stamina back. If you've been really sick, let's say people that have had COVID and had a really bad reaction, they talk about these long haulers. These long haulers, what they're doing to exercise and try to get their life back to where it was before they got it, that's the tertiary, because they no longer have COVID, but they're still dealing with signs and symptoms of the disease that they had. These long haulers, what we're treating for long haulers is tertiary. Does that make sense? Doctor? So there's examples that are absolutely.
It can be chronic, and it can also not be chronic.
Yes, it can be anything that we're trying to make somebody get back to normal.
MashaAllah.
Okay. So they can still have the disease, and they also can be already cured and just curing the symptom.
Yeah, we're talking about somebody that's technically, think about, and I know this is chronic, but think about somebody that has a heart attack. They have a heart attack. They go in and they either do a stent to open up the artery or they do a bypass. They heal at the hospital. They're at the hospital for 3 or 4 days. Then they're discharged. Okay? They're no longer having a heart attack, but we still are going to do rehab and other things to try to make them back to their life before they got sick. That's tertiary.
Doctor?
Does that help as well?
Yeah, I understand now. Thank you.
Perfect. Okay, guys, I really hate to do this, but we're at 10 after almost. I do have other classes and other students, okay? So, like I said, we're going to leave now. I have office hours. You know where to find me. Yeah.
Thank you, Doctor.
Bye.
The external
Doctor?
sites are the exam.
Okay. Guys, I'm going to stop recording and we're out of here. Okay?